Today, the Western Cape government marked World AIDS Day under the theme Equal Rights, Equal Care, bringing together leaders, healthcare professionals, and community members to shine light on the fight against HIV and AIDS. This is what Premier Winde had to say.
Of course, our province, I'm really happy with the numbers that we see, our infection rates coming down, our percentage of infection rates coming down, those who know their status and are on antiretrovirals, the numbers are coming down and more people are on the antiretrovirals. We need to all be tested and know our status. But of course there are concerns and we've got to make sure we get this down to naught. We can get it done, but there are concerns. I'm worried about the age cohort, younger people presenting with HIV and AIDS from 15 years old. Wow, that is just something that we need to say, where's the responsibility, where's the parenting, how are we helping our children? Because that cannot be, that's something that of course we must all take responsibility for. And that was my message today. It's about the care that we give, the systems that we engage in through our healthcare system and dealing with HIV, AIDS and TB at the same time. But of course, it's about responsibility of every single citizen to take care of themselves and to make sure that we help others that are faltering or others that are not making it, and especially our youth. It ends with making sure that we fix it at the youth space.
Joined in the conversation was frontline worker Nelis Grobbelaar, who gave a reflection of 20 years of HIV care and treatment.
AIDS Day, I just reflected on 2003, and I think the important message is that over the years there's a lot of science that happened, but there's also a lot of stories that was generated. And I think the important thing is to bring the stories on World AIDS Day, because we use stories to understand the world, and science without stories is not alone going to stop the HIV epidemic. And most of the stories we get between the healthcare worker and the patient. And sometimes you can have a lot of discussions and things, but sometimes you have the real moments where the patient gets the insight and the doctor or the nurse get insight about what the patient needs. And that's that magical moments. That's part of the reason why we're so successful with HIV. And what I'm really advocating is that we all should appreciate those moments. We should gather that moment and not just look at the time from when we started and all the goals and milestones. We actually also need to really do something to make sure that we have enough insight for moments that change people.
To a day that was filled with insightful conversations around HIV and AIDS, we asked community members what the right to health means to them and how we could possibly support communities in combating HIV. This is what they had to say.
I think that combating HIV in South Africa would start with empowering young girls to make sure that they understand consent, that it's their body, their right, and that nobody is allowed to force themselves on them, just to empower young girls at school level.
Through education, and a big thing is through community. I think, again, my belief is, as a community, if we can be educated on it and destigmatize what's happening around us, and the importance of working together as a community to help each other work through this, because it's not the be-all and end-all of your life. It's something that is very much, you can live with it happily for a very long time.
From personal testimonies to practical solutions, today's event demonstrated that World AIDS Day is more than just a commemoration. From People's Post,